right, so here's kind of a hot button subject I'm going to ask you about. I think we've established that people gaining weight after a plastic surgery is kind of detrimental to the actual outcome, right? Like it's not going to look as good.
Right.
So how do you handle in today's age where every single person is on or has tried or wants to try a GLP-1, where they come into your office, they're currently on it, maybe they're at their goal, not losing anymore, stable, but you know that the minute they go off, all the weight's coming back. What kind of discussion do you have with them about that? Do you want them off that medicine for a little bit before you'll intervene? How do you handle that as a plastic surgeon with weight regain and the medicine?
Well, carefully, I think is the best answer. Now they all have to be on just my own office protocol. They have to be off of their GLP-1s for 3 weeks before surgery, just from an anesthetic standpoint.
Safety issues with.
Yeah. Is that because it slows the GI? Mm-hmm. Okay.
Yeah. It slows down the GI tract. And so when you guys say nothing to eat or drink after midnight, that's to let your stomach empty out so that when we put you to sleep, you don't have stomach stuff come up into your lungs. Well, if your GI tract is slowed down, is not working normally,
right,
you're still going to have food in your stomach in 12 hours. Mm. And so we want your stomach to be working normally. And we still have people go on liquids that have been on these things that day before just to try and mitigate that. Because in a hospital, an aspiration is bad, and an outpatient surgery center can be disastrous.
Right.
So we're really careful about that part of it. Weight regain in my office really is more of an adult discussion. I tell them, like, you're an adult, you make adult decisions. You have to understand that if we do this and you stop these medications and you're not watching what you're eating, you're not exercising, and you gain 20, 30 pounds, that's you have to make that decision. Mm-hmm. How bad do you want this? And are you willing to take that risk?
Well, so that's kind of what I wonder about because we'll see plastic surgeons now prescribing GLP-1s, cosmetic surgeons prescribing them to get them down to a weight to then do the procedure. But very few patients understand that the medication is intended to be taken for the rest of their life. Like it's not supposed to be stopped, because when they do, it all comes back. And then if they get back on it and you go back down, I mean, I would think it would have some pretty serious effects on the outcome, like how it looks, the actual aesthetics of the procedure. So it's new enough now. There may not be enough out there, but that's what we see. Anybody who stopped it comes back. And so I'm sure you're seeing a lot of people now who've lost weight on GLP-1s.
Tons. I'd say probably 30% of the people that come in my office are on a GLP-1 agonist.
Wow. So do you see any difference with like loose skin, GLP-1s versus bariatric surgery? Is there any difference?
I can't say that I've noticed a difference. No, it's,
okay.
It really, where I noticed but I haven't looked at it from GLP-1 versus surgery. It's how much weight have you lost?
Right.
Right. Well, so there's a lot of talk now that you'll read about the term Ozempic face. Mm-hmm. What does that mean? And what does that mean to you as a plastic surgeon?
So Ozempic face is essentially just accelerated facial aging. One of the three, and I did an entire podcast about this, and I talk about it every single day with every patient that comes in talking about facial rejuvenation. There are really three components of facial aging, one of which is volume loss that happens over time naturally. Mm-hmm. We all have fat compartments there are very discrete deposits of fat in our face that change over time. And one of the hallmarks of facial aging is volume loss in the, kind of under the eyes, in the temples, around the mouth. And what what people have termed Ozempic face is this rapid volume loss in those areas that makes somebody look hollow and gaunt and unhealthy.
Mm-hmm.
Is that also because of like muscle loss as well? Because that's something else that we see with the medicines. About 25% of the weight is muscle mass. But I don't know how much muscle there is in the face that would cause that.
Yeah, the volume of muscle in the face is so small, and the muscle volume, other than a little bit of temple and masseter muscle, so your jaw muscles, really doesn't contribute to your facial shape. What you're seeing is fat volume loss.
That would make sense.
Yeah, and it seems that term, I guess that makes sense. It's just accelerated. You see it a lot faster in a younger person. Mm-hmm. So would you say it's like if a 45-year-old had that, that's what they would look like at 55 or 60? Like how much acceleration, or can you even predict that?
It's hard to say. It's hard to put a number on it, but it's kind of like what was that Supreme Court justice back in the 80s talking about porn, like it when you see it. It's kind of like that. It's like it when you see it.
Well, you can spot it, especially if you haven't seen somebody in a while. I mean, there's a definite facial characteristic that we see where it's just really really hollow. I guess that's the main thing.
What makes it stick out.
Yeah.
Right.
And one of the problems from my standpoint is that for facial aging, one of the main tools that I use is surgical fat transfer.
Mm-hmm.
Yep. But when you're on a GLP-1 agonist, there's not a whole lot of information about it. But that, I kind of tell people, I don't know what this is going to do. We should get an 80 or 90% take of this stuff. I don't know whether that's going to be a 0% take or whether it's going to be 80%. I have no idea. We just don't have enough time and information about it.
Yeah, that's really interesting. I hadn't even thought about that.
I have a question with facial stuff. Is there anything that you would recommend to people to prevent, like, while they're losing weight, like looking older, with the weight loss? Is there anything they can do?
So one of the things, I think it's important to remember that bariatric surgery and Ozempic and tirzepatide and all these other things, what that really is controlled starvation.
Yeah.
And so your nutritional status is going to affect everything. And everybody that's gone through bariatric surgery can attest to this. Your hair changes, your skin changes, your fingernails change. And so micronutrient supplementation, making sure you're getting enough protein, things like vitamin C and, all of the cofactors that you need for healthy skin, collagen, protein, things like that is important. Is that going to prevent it? Probably not, but it could slow it down a little bit.
Okay.
That's the same stuff we see with just being healthy after bariatric surgery in general. That's why we preach follow-up and vitamin supplementation. And a lot of the things Jason just named are kind of the same with hair loss, like getting your protein in, making sure your vitamin levels are appropriate. All of it.
But even with that, I mean, it can still happen. I mean, I was diligent about it but the dietitians did tell me that if I wasn't doing those things, it would have been, she said they see people come in and like all their hair is gone. So
non-compliance is probably one of the worst things that you can see in both bariatrics and plastics, I would imagine. I mean, it just sets people up for a real disaster. So, and there's just no reason for that. Let me ask you this. There are a lot of people out there that talk about fleur-de-lis tummy tucks versus a regular tummy tuck. how do you decide which one is better? And by fleur de lis, in case people don't know, it's an up and down incision and a bottom incision on the tummy. How do you decide? And do you do fleur de lis?
I don't anymore. I did.
Okay.
There are plastic surgeons out there that have made their careers doing bariatric body contouring and do fleur de lis, and they get beautiful results. So it's not a bad operation, but it also, that vertical scar that goes from your solar plexus to your pubic bone
Can't hide
and
it.
around your belly button, you can't hide that anywhere.
Right.
So what a fleur de lis is designed to do is to take out extra this way.
Right.
So if you grab right in the middle and pull straight forward, it's designed to pull that out and remove that extra skin. The problem is that when we're doing this surgery, is a lot of the blood vessels that go to the skin get divided so we can get that skin out and pull it as tight as we can. And if you're dividing, you're taking a big wedge out of the middle, you're further compromising the blood flow to that skin. And so you've got to be really, really careful, or you can create a humongous wound at the bottom of somebody's abdomen.
At that T-zone.
That can take 6 months to heal.
Mm-hmm.
And so I don't do them. We'll talk about them if somebody's interested in it. I found the benefit to doing them and tightening up a little bit in the waistline isn't worth the risk for a lot of people.
Right.
But again, there's a surgeon in St. Louis who's I interviewed with during plastic surgery. We're buddies. He does fleur de lis, abdominoplasties, and body lifts all the time and gets great results.
Mm-hmm.
So it's not a bad operation. You just got to, again, like we were talking about earlier, go to somebody who's got experience with it, who does a lot, who gets good results.
Right.
I think that's probably the key to lots of these surgeries.
Yes.
Yeah.
Go to somebody. Yes. Same with bariatric surgery. We talk about that all the time. So, okay, we'll kind of wrap it up maybe with this question, because I feel like this is like one of the number one questions I get on my social pages is about insurance. And do they cover plastic surgery, skin removal? What is your experience with that?
So I will preface my answer with, I've been out of network with insurance companies since the day one of practice. I think health insurance companies are probably the biggest scam going in American medicine right now. Mm-hmm. You have to check whether it is a covered benefit.
Yep.
And then you have to talk to the insurance company to see whether it is going to be a covered benefit for you, and what the criteria for that is. So in the past, when we've tried to go down that road, you have to have rashes underneath your pannus, and have to have tried all sorts of over-the-counter creams, had to have been admitted once for IV antibiotics. The number of hurdles are immense. And then the procedure that the insurance companies cover is not a body lift or a tummy tuck. Mm-hmm. It's a procedure called a paniculectomy.
Right.
And unfortunately, some of my colleagues will take that to mean an operation that needs to be done as messily and as quickly as possible, that doesn't need to look good. It just needs to fix the problem, ignoring the cosmetic part. And I've got a patient that I'm taking care of now who went in for a paniculectomy somewhere else. And the guy told her, he said, "Look, you're going to wake up and you're not going to have a belly button anymore." I'm like, what?
Because I've heard sometimes insurance won't cover a new belly button if they're paying for the paniculectomy. I don't know if that's true.
Well, it's not, because the paniculectomy is only
They're going underneath that.
it's only the lower skin.
Yeah.
And an insurance will say the only medical reason for this is because of the rashes and infections, and those take the skin off that is covering that up. That's all that needs to be done. So Jason couldn't be more right. When you see somebody who's only had that done, just their lower abdomen, it is one of the, it's a sight you can't forget, because the entire upper abdomen is untouched. So if you have loose skin down low, you probably have loose skin up high above your belly button. So imagine it's like flat below and then all the stuff on top.
Yeah.
Our experience is that, I mean, they make the hurdles almost
You're not going to get the
impossible.
results you want with that. Yeah.
You won't. I mean, you may get that, and then you pay for the other stuff. So it's hard. It's really hard. And I've never seen anybody cover arms or thighs or necks. Maybe breast reduction insurance can cover it. Again, there's criteria. Definitely not a breast augmentation unless it's probably in the setting of a breast cancer reconstruction would be the only time I've seen it. So
Right.
it is hard. And if you just call your insurance company and say, hey, is this covered? They'll just tell you yes. You have to get down to like, what does my policy say? We had somebody that we did all the documentation of the rashes for 3 months. They were 2 years out. Their penis heading below where it needed to, but they denied it because on the specific plan, because the patient had only used the creams, but never had antibiotics either by mouth or by IV. And it's like, or what's even worse is it has to be resistant to
those
that.
antibiotics.
So it's like, okay, the antibiotics worked. I'm looking at the patient and there's no rash. So am I supposed to just treat this patient with antibiotics for eternity?
In perpetuity. Yeah.
Yeah. That's what they want. So
Yeah.
the whole insurance comment.
That's a whole nother conversation. Yeah.
I couldn't agree with you more. So, well, with all that said, it's great catching up. Really appreciate you joining us today.
Yeah,
thanks
this
for
was
having me on.
good.
It's got to be one of the top plastic surgeons in the country and a good friend. So proud of all that you've accomplished out there in Knoxville. So,
well, likewise, it was I appreciate you guys both hosting me. This was a lot of fun.